welcome. My name is Linda Friday, and I'm the president of the Queen Anne County Chamber of Commerce. And we'd like to thank Shore Health for hosting our July event this month. So thank you to Shore Health. At this time, I just want to let you know we do have water, so if you need water, raise your hand and someone will bring it to you. Also, during or after the event, we will be touring the new medical facility here in Graysonville. I'm sure that some of you have watched this place just develop, and we're very, very fortunate and blessed to have the ER facility and this pavilion here to serve the people that live here in Queen Anne's County. So thank you to Shore Health for making this actually a reality for the people that live here. At this time, I'd like to introduce Ken Gazelle, who's the president and CEO of Shore Health System.
Thank you, Linda. Thank you very much. And thank you also to all the Chamber colleagues for helping us celebrate this dedication to this afternoon. First and foremost, I'd like to start off this evening's celebration off right, and I'd like to ask Dr. Brian Childs to come up, please, and provide the invocation for us. Brian? Thank you.
This building is a result of cooperation between the Shore Health System and the community and practitioners. We've all watched it being constructed. Saw the steel and the iron and the brick and the mortar and the glass and the wood. And it's an impressive structure, but it's not a structure just for itself. It's a structure in which people will come. People who are anxious, people who are scared, people who are hopeful, and people will be coming in here who are practitioners who themselves may not be feeling very well that day. And so this structure is for people. And like the building across the way, it's a beacon on the highway that says, we are here. And humanity, you may come to us. And let that spirit prevail as we dedicate this building. Amen.
Thank you, Dr. Childs. I'd like to start this evening's celebration by acknowledging some of our VIPs and guests that are here with us this evening. First, some of our elected officials are here. Delegate Steve Hershey. Delegate. And our Queen Anne's Commissioner, President Steve Arnez. There are a few Shore Health Board of Directors here with us this evening. Mr. Keith McMahon and Mr. David Milligan. Some of our friends from the University of Maryland Medical System are here as well. From Baltimore Washington Medical Center, it's President and CEO Karen Olskamp. And President and CEO of Chester River Health System, Mr. Jim Ross. And two members from our Queen Anne's Association are also here with us this evening, Kathy Butez and Mary Tomlin. From the Dorchester Health Department, Mr. Roger Harrell. And from Whiting Turner, Mr. Bruce DeLauder and Mr. Frank Palmer. The dedication of Shore Medical Pavilion marks the expansion of Shore Health System's network of medical care that spans 4 counties of the Mid-Shore region, including Caroline, Dorchester, Talbot, and Queen Anne's County. Shore Health expanded its services in Queen Anne's when the Shore Medical Pavilion opened in December 5th of 2011. And as you all know, very many people made this possible for us to do this. I want to start by thanking Mr. Bob Krenzik, President and CEO for the University of Maryland Medical System, and Dr. Albert Reese, who could not be here with us this evening, but he is the Dean of the School of Medicine, and the University of Maryland Board of Directors for their support with this project. Also, thank you. Also, many people contributed to the expertise, their expertise and time to this venture. I want to pay special thanks to Mr. Rick Dunning, our Senior VP of Facilities Planning and Design and Construction, who was instrumental with this project. C.R. Goodman and Associates for their creativity and attention to detail and design. For Whiting Turner for their professionalism with which they approached this construction project. I'd also like to acknowledge team members from every discipline at Shore Health System who played a role in helping get this facility off the ground and ready to treat our patients. Mr. Tony Kelly, the project director. Shore Health directors, Gary Jones, Gary Bigelow, Bill Roth, and their team members who offered advice about the design and operation of the facility and stepped up to add this service to their areas of responsibility. Also, team members from our IT department, food services, security, marketing, and communications also played a major part in building this project. I'd also like to have a special acknowledgement for the Maryland Primary Care Physicians Group, who is the first and largest tenant of our building, and they provide a perfect complement to the diagnostic and specialty medical services offered on the campus. And we're going to hear a little later on from Mr. Don Bunce, the CEO of MPCP. He's going to tell us a little bit about his tenure here in the building. I'm also grateful for the enthusiasm of our physician partners and a number of specialties who have expanded their practice to join us here at the Shore Medical Pavilion. They include a couple of cardiologists, Dr. John Condit and Dr. Tim Shanahan, neurologists, Dr. Waleed Kamshay and Dr. Balat Salat, our ear, nose, and throat specialists, Dr. Timothy Snyder and Dr. Lori Porter, our urologists, Dr. Dwayne Cespedes, Dr. John Foley, Dr. John Knut-Hutzien, and Dr. Chris Runs, and our gynecologist, Dr. Zarma Kupas. I'd also like to thank the Queen Anne's County Commissioners and their colleagues for their ongoing support in developing this medical center campus. Shore Medical Center is an integral part of Shore Health System's strategic plan that addresses the long-term medical needs of the Mid-Shore region. In addition to the Shore Medical Pavilion, we operate the Queen Anne's Emergency Center, which is directly adjacent on this campus. And in October of last year, we celebrated the 1-year anniversary of the Queen Anne's Emergency Center, which is one of only 3 freestanding emergency facilities in the state of Maryland and the only one in a rural area. This center operates 24 hours a day and treats patients of all ages with all acute illnesses, injuries, and traumas, as well as minor injuries. Last year, they saw over 13,000 of our community citizens in their facility. In addition to the services available on this campus, we continue to provide family care in Centerville as well. And Shore Medical Center and Shore Medical Pavilion is more than a medical office building to us. It offers one-stop shop healthcare for Queen Anne's County residents and the many people who travel up and down the Route 50 corridor. And in addition to Maryland Primary Care Physicians that I mentioned earlier and our other physician partners, Shore Medical Pavilion also offers a variety of diagnostic and treatment services. And they include physical and speech therapy for people of all ages, diagnostic imaging and lab services including X-ray, MRI, digital mammos, bone density scans, ultrasound, EKGs, and phlebotomy, cardiovascular diagnostics including echocardiograms, stress testing, and Holter monitoring. And we also offer the Shore Health's 3rd Regional Sleep Disorder Center for overnight sleep studies. You'll have the opportunity to see these diagnostic and treatment centers when you go on the tour this evening. And now it's my distinct pleasure to introduce to you Mr. John Dillon, our chairman of the board for Shore Health System. Mr. Dillon?
Thank you, Ken, and thank you all for being here this evening. And on behalf of the Board of Directors, I'd like to thank Ken and his whole team for making this day possible and making what you see here today possible. And Ken would be the first to admit that we couldn't have done it alone here at Shore Health, that it took a joint effort with our partners, the University of Maryland Medical System. They've been tremendous partners of Shore Health System ever since we affiliated with them. And with them at our side, we're moving healthcare in an upward direction here on the shore, and this is certainly a good example of that. And you know, one of our visions has been to take the wonderful care that we provide at Shore Health System and move it out into the communities and to be as close as we possibly can to the patients we serve. And this is a wonderful example of what we can do here. So we're just excited as we can be about this whole thing. And I want to now introduce to you Bob Krenzek, who is the CEO of the University of Maryland Medical System. He has been an enormously good friend to Shore Health System ever since we associated with the University of Maryland Medical System. I think partnering with them, we can just keep moving forward and make healthcare on the shore better than it's ever been. Bob?
John, thank you for the kind remarks, and everyone, it's a real honor and privilege to be over here today to dedicate this building. This is a very, very important moment in time for our organization. For those of you who may not be totally familiar with the University of Maryland Medical System, it's a pretty large 13 hospital system that spans the entire state of Maryland. And on behalf of all 18,000 of our employees, this is an important location and a very important operation. As John said, the Shore Health System joined the University of Maryland Medical System back in 2006, and we have enjoyed just an unbelievably productive and positive relationship. Opening this new medical facility is really a very important opportunity for the University of Maryland to become the healthcare provider of choice here in Queen Anne's County. And it's really going to allow us to expand pretty significantly, and you heard that from Ken Kozel as he listed those various specialists that are here, that we think we can continue to expand the scope of medical services offered by Shore Health System here in the Mid-Shore area. Our partnership with the Shore Health System has also made it possible, we believe, to offer more convenient care to the citizens of Queen Anne's County. Not having to either go over the bridge or truck on down to Easton, we know is a big deal, and we want to continue to make specialty care more convenient here to the citizens of the county. So on behalf of the Board of Directors of the University of Maryland Medical System, I want to particularly thank our physician partners, all standing around here, as well as the staff, for their dedication to the success of the site. And I really want to thank the community here for their enthusiasm and support, not only for the medical office building, but for the emergency care center. It's a big deal, and this community has been welcoming right from the beginning, and the partnership has been amazing. And then finally, I want to point out that the University of Maryland Medical System, our large hospital system, enjoys a very, very strong and valuable partnership with your state's medical school, the University of Maryland School of Medicine. And that is really a world-renowned research and teaching institution. And if you go around this building, you go around the Eastern Shore, you'll see that the University of Maryland School of Medicine trained many of the physicians who practice here on the shore. So it's a real privilege for me to introduce my partner here, Dr. Tony Lehman. He's the Senior Associate Dean of Clinical Affairs in the School of Medicine, and I'm going to ask Tony to come up and offer some remarks. Dr. Lehman.
Thanks, Bob. Well, Dean Reese sends his regrets that he couldn't be here today. He's asked to host the Lieutenant Governor back on campus. So it's a great pleasure for me to be able to come out here and celebrate the opening of this facility with you. And congratulations to Shore Health and to the system for this opening. As Bob said, we are the state's medical school. We do many things around the world, but I think one of the things we take greatest pride in is providing physicians for the communities across Maryland. And I can't think of a better example of an opportunity here today of what that's about. As you know, next door, our faculty already provide emergency services in the Queen Anne's Medical Emergency Center. So it's a great pleasure for us to congratulate all of you, everyone responsible for the opening of this center. And on behalf of the Dean and the faculty of the School of Medicine, it's a great evening. Thank you.
Thank you, Dr. Lehman. I'd like to take a second to introduce Mr. Don Bunce, the CEO for Maryland Primary Care Physicians Group. As I mentioned, they're a tenant in our building, and more than that, they're a friend, and they are sharing the vision with us of how we can conduct primary care in the Mid-Shore region. So, Mr. Bunce?
Thank you. Thank you, Ken. maybe you saw Ken lean over to me and he said, "There's plenty of hot air here tonight. Don't get started." So I will be brief in deference to my good friend Ken. I'd like to share with you just a little bit of our history here, and a lot of that starts with the patients in this area. We've been committed to patients in the community here for, I believe, Tom Walsh told me 24 years, Tom, is that correct? Right. This is Dr. Walsh, who's actually the founder of Maryland Primary Care on the Eastern Shore. And I come here tonight representing our board of directors and our physician president. He did not have an official event to attend. He had a better excuse. He just texted me and said, "You're on, I'm with patients." So he's doing what we like for him to do, and he's with patients. We also have a member of our board of directors here, Dr. Jamie Harms. Our CFO, member of our board of directors, Lisa Weber. Dr. Dan Koenig is here somewhere. All these people are treating our patients. And we have Dr. Jamer Chamberlain, who's, I guess you were the first man in after Tom. Is that the way? Is that the way it went? So we're very happy to be part of this community. We have about 10 practices around Central Maryland. And I was talking to our practice manager, Maggie Burkhead, earlier and telling her that this is the nicest and the best. And it also builds on a tradition. I'm looking at my good friend Karen Olskamp there. It builds on a tradition that Maryland Primary Care has with the University of Maryland Medical System. It actually started with BWMC before it was BWMC, with Karen and her associate and friend of us all, Jim Walker. And that was the origins of Maryland Primary Care in 1996. Since that time, we've done a variety of things with the University of Maryland Medical System, of course, hopefully not culminating, but most recently with this wonderful facility here. And we're very pleased and proud to be able to provide services here, and we're thanking you for inviting us here. And I think the phrase that was used was we were the anchor tenant. So, you know, I hope that's a positive thing. And we hope that it is. But thank you all for coming out tonight. Was that brief enough, Ken?
That's perfect.
Did he put the hook away?
Now, I'll close by saying that as I look around at the audience, I first again want to thank everyone for coming out today on such a warm day and for your patience and standing here listening to us. But hopefully what you've gathered from today's presentation is the pride that we all have for this center. And as Dr. Childs so eloquently said, it is a beacon of hope and of health for our community. And it really is the result of all the hard work of everybody that's out here with us. We appreciate your efforts. We appreciate you being here. We hope you can find time after the ribbon cutting ceremony to please take a tour of the facility. It is magnificent, and it is just the right type of care that we needed to provide here in Queen Anne. So again, thank you very much for being here. We're going to cut the ribbon, and then we'll start the tour shortly after that. Thank you.
And I'd like to invite out all the people who work in this building, physicians, anybody who has a role to play in this building. Please come up with our speakers and participate in the ribbon cutting ceremony. And this is the photo op if anybody has their camera.